Well, welcome back to our Protecting Every Future community. It's great to have you with us so we can talk about all things related to people and their financial security. And we have a really pertinent and great topic today, which is paid family medical leave. And we have two leaders, thought leaders, and experts in the United States Congress to talk us through with what's happening. And I think give us a little optimism that something's going to happen, and they'll also tell us how we all can help. Allow me to introduce Representative Chrissy Houlahan from the Commonwealth of Pennsylvania and Representative Stephanie Bice from Oklahoma. Welcome to you both.
Thanks for having us.
Well, just to level set here, so everybody's that's listening and watching is with us. When we say paid leave throughout our conversation, from the insurer's standpoint, paid leave is income protection for people that have to take leave to care for themselves. And this can be for the birth of a child, for the adoption of a child, for fostering a child, for taking care of an elderly parent. It can be maternity leave, it can be paternity leave, all of the above, but it's income protection while people are taking care of really, really necessary, important things. So through your lens as members of Congress who are leaders on this issue, how does Washington define paid leave?
Stephanie, you want to go ahead and take that, and then I can add it?
Sure. I think that's been one of the questions that we've tried to sort of walk through. A little bit of background about what Chrissy and I have been doing. We decided to take on this endeavor at the beginning of this Congress. So this has been so far 18 months in progress. And for us, it was taking a step back and starting from ground zero, really getting a better understanding of what family medical leave would look like, what it entails, to your point. Is it just the birth or adoption of a child, or are there other things that are included? And so we've sort of come to this, I think, agreement that, yes, it does cover a broad range of topics. It's not just necessarily birth or care of a child or an adoption. It's definitely open to other things. Now, whether or not we can encompass all of those things in a family medical leave program may be a little bit of a different conversation.
Yeah, exactly. And we did start sort of from scratch. It was the 30th anniversary of FMLA, and we actually, as one of our very first actions, brought in the folks who were successful in that piece of important legislation to try to understand sort of how they defined their boundaries, how they got to yes and how they got to success. But it's complicated, and we're just looking for more paid leave for more people. That's kind of the motto that we're leading with, because we know that we likely won't be able to solve for everybody's issues right out of the gate, but we need to make sure that we're solving for the 75% of Americans that believe don't have access to paid leave.
And so let's take it directly to your constituents. Is that the real driver for you all to step up and take this on? What are you hearing from your constituents in Pennsylvania or Oklahoma?
For Pennsylvania, and I believe it's probably the case for the rest of the country, including Oklahoma, this is not just a mom issue. This is not even just a family issue. This is an economics issue. This is an issue for the hardiness and health of our economy and our businesses. And it's also, in my opinion, therefore, a national security issue as well. So we need to make sure that we're reframing the conversation so that people don't just think about this as being, whether somebody can take some time off when they have a child, but rather how this whole thing is tied up in the larger economy and our place in the world.
And I think the other piece of that is, this is a pro-family issue. We want to be able to support families in our constituents' respective districts. And so making sure that we're hearing from them, understanding what the challenges have been. We learned a lot from COVID. You saw so many moms, particularly, that had to step out of the workforce to be able to, take care of children, and losing that income. And we realized that some of those individuals actually didn't go back into the workforce for a lot of different reasons. But, if we look at it from the context of making sure that we're supporting families, I think that that's really a driver for both of us.
Personally, as somebody who's cared about this issue for a long time, because I think it is important and essential policy for all the reasons you say, the pandemic was a turning point where just a lot more people that were employers and family members and others understood, I think, really what was at stake here. So we're grateful to both of you for providing leadership and seizing the moment.
Yeah, And we were literally looking into each other's living rooms and kitchens. And I think that was a real wake up call for how the world is really working and how we're just threading together childcare and family care and household by household. I think we realized we really need to do something better.
Well, for all of us who have been working parents and raised children, in my active days of that, I always felt I was just a few seconds away from some total meltdown of the whole complicated system that I was juggling between my children and work and everything else. And I know many or most of our Protect Every Future community feels that way as well. Well, as you said, it's you want more paid leave for more people, and we all support that pragmatic approach, just like get stuff done and keep moving forward. There is something to build on. We in the private insurance industry have been providing paid leave benefits for a long time. We know 75% of people would like to see a public and private, a government and private solution. Kind of what are your thoughts on that? And can we leverage what we already know and what we have and get more?
I think that's one of the pieces that we're actually working on is a public-private partnership. The challenges that we face, I think, in putting something like that together, excuse me, are that we have over a dozen states now that have already implemented some sort of paid leave initiative. Some of them are a public-private partnership. Some of it are a mandatory government program. And so trying to thread the needle where we're not, usurping those states that have already put something in place, but also recognizing that we can actually take a little bit of information from the states that have done something with the insurance industry and maybe model what they're doing into a federal package, I think is something of interest to both of us.
Yeah, and kind of the work of the working group was to do this survey, sort of, as Stephanie said, from ground zero, trying to build up a common set of information and common understanding of what had been done in the past and what has worked and what could work in the future. And the work output so far of this committee or working group has been a 4-pillared approach. Solutions that we hope will get more paid leave to more people. And one of the pillars is a public-private partnership. And Stephanie also is correct in alluding to another one of the pillars, which is understanding what best practices are, trying to make sure that there is an understanding of the 13 or 14 states that have moved forward on this. What are they doing right? What are they doing wrong? How do they share information with each other? How do we get that information to other states as they transition into paid leave programs? And how do we make sure that we're not reinventing the wheel? So that's another one of the 4 pillars that we're looking at, and hopeful that will be able to help us. If we can't move more quickly as a federal government, we will be in the position where more states will. They'll do what they need to do, and it's understandable that they need to do it. They're feeling the same pressure and revelation that we are feeling, the importance of getting this done. So I think it is urgent that we figure out a way to federally help the remainder of the states be able to make choices on their own, and the states that have done so also to be able to continue to grow those programs and share their best practices.
Well, I think education and possible solutions, which is at the center of your pillars, it sounds like it can perform a great service out there just to advance thinking that this can be tackled. It's not easy, but it can be done. Let's just focus a minute on small businesses because they can be particularly challenged in just affording the infrastructure and the ability to support their employees. And that is where we see a great need. What are your thoughts on that?
So that
you want to take that first?
Yeah, that is in fact the third of 4 pillars is a pooling of small businesses, insurance pooling proposal. And for exactly that reason, I'm an entrepreneur, was a small business, operator for most of my career before joining Congress. And I know how hard it is when you have a very small number of employees. And as you mentioned, kind of limited resources and limited bandwidth to be able to manage this. And so one of our proposals is this, kind of combining of small businesses and pooling them into either insurance pools or some other solution to make sure that we are addressing this need. A large part of our economy is driven by small businesses. And so, and to be honest, much of our economy that is larger business has potentially already solved for this, paid leave issue. So we need to make sure that we're helping the communities and groups that haven't yet found the solution set to be able to move forward on that.
That's exactly right. And I would just add that as we were doing our homework and research and bringing groups together, we brought together organizations that represented either single employer businesses, think of a Etsy or even an Amazon storefront, but also, these chambers of commerce across the country that have a lot of businesses that are small businesses that, may be able to partake in some of these programs that we're looking to try to put together.
And what's your prognosis? I know you're trying to lay the groundwork now in 2024 before this Congress recesses this fall and goes home to elections, with an eye toward really moving the ball forward in 2025. What's your prognosis for the future as we look at a new Congress convening in January?
I think that, we're in a really good place. We've spent a lot of time doing our due diligence and asking the right questions and understanding really what's going to be required as a compromise for both sides, because, we come from different political parties, we come from different, sort of backgrounds. And so figuring out what works is going to be, half the battle. But then also people often forget that we also have to negotiate with the Senate, and the Senate has a very different dynamic and a very different set of sort of ideas on how they want to address the paid family leave issue. And so it's a negotiation, it's a compromise, it's going to take some time. I think I'm going to speak for Chrissy just a bit here to say that we would have probably preferred to have something done and rolled out by now. But we also recognize that rolling out something that isn't thoroughly vetted and hasn't really gone through the process would be to our disadvantage. And so taking that extra time and making sure we're getting it right is really important. And so when we start either later this year or beginning next year, really trying to socialize this with our Senate colleagues and figuring out, how do we make this come together? That's going to be the focus.
But the good news is that there is a bipartisan group on the Senate side that is also working on it and with us. And so this is a historic moment in a lot of ways. There has never been a bipartisan group working on the House side on this issue before. And so we're, hopefully cutting new ground here. And the fact that we have been working very, very collaboratively with the Senate, hopefully will make us, for those who are old enough to remember Schoolhouse Rock, will make it so that it's possible to bring together a piece of legislation that both the House and the Senate will be able to bring to the president's desk for signature.
Well, you're both very inspiring in your commitment, your leadership, and your willingness to work together. We need more of that in this country to get hard things done. My last question for you then is, what do our Protect Every Future community members who are in Oklahoma or Pennsylvania, what do they do to help you or elsewhere in the country to create momentum for this?
Well, if they're in the 6th Congressional District of Pennsylvania, which is just outside of Philadelphia, I've got you. I this is. But if you're somewhere else from some other district, either in the Commonwealth or in Oklahoma or other places in the country, please, please, please call your member of Congress and let them know that this is a priority for you.
And your senator.
Good point.
More paid leave for more people. Love it. That's our rallying cry. Thank you both very, very much for spending time and for your leadership. We appreciate you.
Thank you.
Thanks, Susan.